Good afternoon, everyone. My name is Sally Bachman, and I have the great privilege to serve as the Dean of the School of Social Policy and Practice. We are also known as SP2. I'm thrilled to welcome you back to the second installment of the 2024-2025 SP2 Speaker Series, Conversations about Race, Equity, and Justice with experts on social policy and practice. The university's recently launched strategic framework in principle and practice identifies 4 great challenges of our time: climate, health, data, and democracy. SP2 is committed to leading on these challenges through the research and practice of our faculty, staff, students, and alumni across the fields of social work, social welfare, social policy, and nonprofit leadership. Today, our speaker series focuses on the great challenge of data. Ben Jealous is our host for today's program called Equitable Data, the Inside Story, how data integration can influence social policy and systems change. Ben is a professor of practice at the Annenberg School for Communication and also at SP2. He's also a distinguished visiting fellow at Penn Carey Law School. Ben is the former national president and CEO of the NAACP and the former Democratic nominee for the governor of Maryland. Ben now serves as the executive director of the Sierra Club. Ben has an unwavering commitment to social change and social justice that is in perfect alignment with SP2's mission. When he was selected to head the NAACP at age 35, he became the organization's youngest ever national leader. His family's strong community activism dates back generations, and we are proud to say that his SP2 connection traces back to his late beloved grandmother, who was an SP2 alumna. So Ben, we're delighted to host this conversation today, and I am deeply honored to introduce you as our host. Take it away.
Thank you, Dean Bachman. And thank you to everyone who joined us today. You know, these lunch time symposia are a real joy, and it's really fun to engage with each of you. Please, today, if you have any questions, just put them in the Q&A tab to submit them. We'll get to as many as we can. Now, it's my distinct honor to introduce our speakers. Dr. Dennis Culhane is an SP2 professor and co-founder of the program Actionable Intelligence for Social Policy, known as AISP. He served as the director of research at the National Center on Homelessness among veterans from 2009 to 2018. A leading researcher in the field of homelessness, Dr. Culhane pioneered the use of administrative data for research and policy analysis. His work led to federal legislation mandating cities and states implement data systems for tracking homeless services. His recent research focuses on vulnerable youth, including those transitioning from foster care, juvenile incarceration in the juvenile justice system, and residential treatment. Della Jenkins is the executive director of AISP. In this role, she oversees its daily operations and strategic partnerships and works to promote the development and use of integrated data systems across the country. Prior to joining AISP in 2017, Della's professional experience included child advocacy, policy analysis, and mixed methods research and program evaluation spanning the birth to post-secondary education spectrum. And last, but far from least, is Bridget Blount. Ms. Blount is the deputy CEO of Baltimore's Promise, where she focuses on ensuring young people have access to programs that help them transition into being thriving adults. She joined the organization in 2018, driven by her belief that everyone should have the opportunity to use their unique gifts. Before this role, she worked as Director of Data and Evaluation at Family League of Baltimore, where she developed citywide management information systems and provided strategic direction for data and evaluation efforts. Dennis, we're going to start with you. Can you kick us off, please, by sharing a bit of the origin story of AISP and the why behind your work there.
Sure. Thanks, Ben. Yes, I've been doing homelessness research for quite some time. I actually got interested and involved in homelessness as an issue as a college student. And when I graduated from my PhD program at Boston College in 1990, and I came to Penn, I met Dr. Trevor Hadley in the psychiatry department, and he was doing some very interesting research, studying longitudinally the patterns of use of services in hospitals and such by people with severe mental illness, people with schizophrenia and such, and learning about how they were getting caught up in the criminal justice system by looking at the jail records. And this was exactly the kind of data I realized that we needed to understand what was happening in homelessness, because most of the research was very limited based on these cross-sectional samples. There was nothing longitudinal. And I discovered that Philadelphia and New York were the only two cities in the country that actually had a system in place for registering everybody who entered and exited the shelter system. And this provided an incredible, I guess you contrast it between a photograph and a documentary film version of seeing a problem, and just so much more rich information. And then by the way, the first results of that was to show how many more people experienced homelessness than we thought, about 1% per year in Philadelphia, and about 3.5% over a 3-year period of the city's population. So not only was the problem bigger, but we also learned that most people's homelessness was really relatively brief, on an average of about 5 to 6 weeks, and that most people get out of homelessness and don't return. And we didn't understand why were people becoming homeless, how were they getting out, etc. And then also it revealed this chronic homeless population, which most people think about when they think about homelessness. They think about chronic homelessness. It's very visible. People are very vulnerable, often have disabilities. But in effect, they really only represent about 10% of the population that experiences homelessness. But on a given day, they are about half the population. And so all of this was revealed by having this longitudinal data, which was crucial. And then I sort of accidentally became expert on all of the legal issues and the technical issues, the methodological issues associated with using these government records, because these are confidential client information records that you're dealing with, and they're highly sensitive. So I started to link the homeless records with all sorts of other data sets: jail data, birth records, death records, school records, Medicaid claims, state hospital records, attendance and achievement for the children, child welfare involvement, juvenile justice involvement. I mean, you name the government data set, disease registries, HIV, etc. We matched up those records, and each one of those agreements to get the data often took 1 to 2 and even 3 years to negotiate access to the data. And the project itself would take maybe a month to go, in 2 months to do the analysis. So in 2009, I happened to be in a meeting of the Mayor's Children and Families Cabinet in Philadelphia. And the group assembled there, the commissioners of the various agencies serving children and families, said, hey, we need to try to do something we can collaborate on and where we can better identify what's happening with the families in our service systems. And John Fantuzzo, a professor emeritus in education, would happen to be at the meeting at the same time. And we suggested that why don't we just link the data that you have so you can understand better the people you're serving, have what preconditions, et cetera, what are the outcomes like, et cetera. And so we created a thing called the Kids Integrated Data System in 1998, and it was housed at Penn. And for 10 years, we ran a process whereby researchers could come in and request access to this data. There would be a review and approval by the agencies who own the data. There would be an ethical and legal review of what was involved, and tried to expedite access to these data rather than having to take years and years and years. And so we learned from that in fact, you could be very productive, get a lot of important projects done, things that had a lot of policy relevance, affected decision-making by leadership, and you could do so in a much more quickly and timely way, because very often academic research comes after the need has gone away for the information. Policymakers say, I need the information now. The researchers say, well, we can get it to you, yes, tomorrow. And, when really the need is immediate. So we created this information system data linkage system to facilitate that, and to some significant success. I mean, just in the homelessness space, we were able to show that housing people with severe mental illness and people who are chronically homeless actually was a break-even investment, because the money it cost, the $17,000, $18,000 a year it was costing to get a person in housing and supported with services, actually reduced people's use of hospitals, jails, and shelters to an equal amount, so that it was essentially a kind of break-even proposition. That led to the Chronic Homeless Initiative of the Bush administration, 2003. 60,000 apartments were funded across the country as a result of that. In 2008, the Obama administration asked me to help lead the effort to end veteran homelessness. We were able to use all of the data. The VA has so much data. We were able to use that to better understand who is where, what services were, what the costs were, and where we could better target our resources. So anyway, in 2008 also, the MacArthur Foundation approached Dr. Fantuzzo and myself about whether we could help other states and cities around the country to build these systems, because they saw the value, they saw how it led to results that were actionable by Congress, by the state and local leaders. So they funded us for 10 years to build AISP. And when we started, we had just 8 communities in our that were doing this kind of work. And now, as Della will explain, we are across the country in many, many places. So it has proven that it does work, and the community of people involved are wonderful, very committed, and see, this invested interest in using data to inform policy and to change people's lives.
Thank you, Dennis. And Della, I'm going to come to you in a second, but Bridget, if you could just help us understand what this looks like on the ground. Talk to us about Baltimore and how you're using data to transform lives in the city.
Sure thing. Thank you so much. So Baltimore, I work for an organization called Baltimore's Promise, and we've been a part of the AISP network since 2017. We were a part of a learning cohort. So Baltimore was interested, similar to what Dr. Culhane just talked about, which is around how do we really understand how well young people are doing in Baltimore. At the time, there was a lot of crisis. The Freddie Gray murder had just happened. Everyone was really up in arms thinking about what does it look like for us to support young Black and Brown young people in Baltimore. And so we came together as a city with the Annie E. Casey Foundation and the Actionable Intelligence for Social Policy to really think about how could we develop an integrated data system. For the next 7 years, we really worked together to think about what is the community governance model we would need to be able to actualize and operationalize an integrated data system. We've been working with AISP and Della's team to really think about what is the technical infrastructure, what does it look like for us to build a governance model, and we've been able to use data now to really support improving outcomes for young people in Baltimore. For example, our priority population is young people between the ages of 14 and 24. We were able to use data to identify that for every one opportunity for young people in Baltimore between the ages of from birth to 8th grade, there was 4 opportunities for young people and only 1 for older young people. So we was able to increase opportunities in the summer of 2023 by 80% and increase funding as well. So we were able to use longitudinal data to really tell the story of opportunities and access. And so these are the types of projects that we'll be able to work on through our integrated data system. But these projects take time. Like I mentioned, we started in 2017. We really started full operation and data integration in the last year and a half. And so it's been work to really set up a governance structure that is built on community voice. One of the things that we wanted to make sure we were doing is creating a system that was equitable, that allowed stakeholders to understand, to look under the black box. A lot of times when we're talking about data, it's often inaccessible to the population, to community members. And we wanted to make sure we were creating something that was, one, focused on decreasing inequity and increasing transparency.
And then when you move through the city, when you visit with the populations that you're serving, like what sort of outcomes have you seen? What sort of what affirms for you that it's all working?
Yeah, I think what affirms for me that it's working and for our organization, and it's interesting because data, yeah, I think oftentimes is really all around us, but we're not actually sure how it's like, is it actually helping us? And so I don't know that a regular, like a community member would not say, oh, because we have the integrated data system, our lives are better off. However, if you talk to our systems partners, when we've been able to provide them with data to say that almost a quarter of young people who were graduating from Baltimore City Public Schools were not showing up in workforce and or in higher education, they then were able to create a career technology office to ensure that young people had a pipeline into workforce. And so it has allowed us to really focus on systems, public schools, city government, to change the way that their behaviors and the way they address certain populations so that larger populations have access to the supports they need.
It's so beautiful. My family's own story starts in the McCullough Homes Housing Projects where mom was raised. And it's so easy for people to think of poverty and lack of access to opportunity in places like Baltimore, something that cannot be overcome. But when you look at the data, you see, oh no, these are actually numbers we can move. And thank you for what you're doing. So Della, if we can go back up, if you will, to about 5,000 feet or whatever, can you just talk about the network of government agencies and nonprofits that you manage, how you guys center data integration and cross-sector collaboration to advance good social policy, but also, again, if you could, at the end of that, just get into like how it actually changes lives and the outcomes that you see.
Yeah, thank you, Ben. So as Dennis alluded to, our network has grown. So 8 jurisdictions back in, 15 plus years ago when Dennis, John, and our associate director, TC, who's been on this journey the entire way, they did the initial scan. It was 8 jurisdictions that were doing this kind of work and that they were able to bring together to have the first kind of cross-site conversation. We're 44 network members today across the United States and growing constantly. And they're all unique. So we often like to say, if you've met one integrated data system, you've met one integrated data system. They are really, really each doing their own thing in their own context. And that's by design. We really aren't trying to standardize practice. We're trying to lift up a lot of different models so that everyone out there can find one that works for them and that they can adapt and move forward with. So each integrated data system in our network, and some of them call themselves that, others call themselves data collaboratives, data trust. There's lots of words for this. Each one is linking a different constellation of data with different data partners and with different ways of staffing that work. Some are embedded in city or state agencies or like executive offices. So here in Philadelphia, Dennis mentioned the KIDS integrated data system that he and John developed many years ago and ran at Penn for a while. That capacity was transferred back to the city and is now embedded within the managing director's office, right? So that's kind of one model of doing this work. Our colleagues across on the other side of the state in Pittsburgh, their integrated data system is housed within their Department of Human Services. So that's another model for doing the work. And then Bridget and our many partners in the network are doing this from kind of a collective impact nonprofit model, or even a university public partnership where the university is staffing a lot of the activities, doing some analysis, but answering questions on behalf of public agencies who are prioritizing what they need to know using the data. So there's lots of ways of doing it. They certainly don't all look the same in terms of their infrastructure or their priorities. I would say what the network members have in common is this commitment to data for action and data use that's responsible and responsive. So we have, as Bridget alluded to, a real focus on governance and decision-making that's collaborative. All the agency partners in each of our network sites have to approve each data use. And there are lots of kind of safeguards in place for how decisions are made. Increasingly, there are also community or resident advisory boards that are driving a lot of the prioritization of projects and approval of data use. And so this is a community where everyone's got their own flavor, but there's a common commitment to data as a public asset, data for public good, building public trust. And our job is really just to get them together. So we always have to caveat, like, we don't hold data, we don't sell anything to these partners of ours, we don't do research with their data. Our job is really to promote peer learning, to document the innovations that are happening in states and cities and counties, what their problems of practice are, and those evolve all the time, and then help new cities and states who are aspiring to integrate data to get started. So we tend to call ourselves, data sharing coaches or librarians or even therapists. And you might be able to tell that many of us on the team have degrees from SP2. So that is our inclination.
Got you. So data coaching therapists, and I'm sure there's a lot of people who could use your services with all the AI anxiety. The wondering for you, like what really motivates you in this work as an SP2 grad? At the end of the day, all of us are committed to, solving real problems for real people in real time. How does the work that you guys are doing make that easier, more impactful? And what sort of changes, what kind of stories do you carry with you to keep you motivated in, helping people, frankly, data comes natural to some, but not to most, I'd say, especially in social change sectors. So what are the stories that you carry with you that really motivate you to keep pushing and getting people to integrate data into their strategy making and the execution of their work?
Yeah, I mean, I came to this work not as a data or technology person. And that's true of almost every person on our team at AISP. We are certainly not technologists. Many of us are not even methodologists at heart. We're generalists who have a passion for social justice and who came to the work through, most of us applied work in one area where we saw the disconnect between what questions people wanted to answer and what they were able to do with the data they had, and the need they felt to tell the story, to advocate for resources using data, and a real challenge there. And so I came to the work having done primarily child advocacy and work in policy in Philadelphia and in Pennsylvania at the state level around access to early education services. And so had been doing a lot of advocacy research and evaluation work in that field, and just constantly felt like we were grasping to connect the outcomes we actually wanted to be able to talk about, right? Seeing where kids end up and how they thrive and what are the supports that that allow for that. And not feeling like the longitudinal, connected, linked data was feasible in the context I was working in. And so when I learned about what was happening within the AISP network, I thought, oh man, I want to be part of that. So the stories that motivate me are the stories of the people who are the data, right? It's the families who are looking for services, looking for support, and not getting connected in an efficient way to things that should be at their fingertips, right? And I think I see that in my personal life as a parent, right? You see the amazing growth that happens in the early years with kids, and you think about the vast inequities that exist in the communities where young children are being raised, and that motivates me on a daily basis.
Let's turn for a second. And by the way, Christine Sarowski in the Q&A had a question about consent. Is consent needed by clients? How do you guys navigate that? You got a bunch of vulnerable people. You're trying to collect data to serve them better, but there's obviously ethics issues there to be considered. Maybe Bridget, do you want to take that first and just talk about how that plays out on the ground?
Yeah, sure thing. So within our private sector, so the nonprofit is mostly governed through consent. And so the way that we do that is get individual consent for young people who are participating in our programs from nonprofits. From the public sector, where we're thinking about the Baltimore City Public Schools or city government, we were able to, there are several federal, state, and local legislations that allow for research and evaluation of populations to be better improve their outcomes. So, for example, FERPA, HIPAA, and other legislations for us in Maryland is the Maryland Public Information Act. And so we have to ensure we're following those legislations to ensure that we are, one, ensuring data privacy and security. And so we have been able to do a combination of either directly consent from young people and from under the exceptions of FERPA and HIPAA to be able to do larger studies of young people. We've really been able to get guidance. So Actionable Intelligence for Social Policy, they have a wonderful toolkit that came out a year ago, I think about, where it talks really deeply around consent and how to navigate that process.
No, thank you for that. And the data is so important when you think about addressing poverty. I mean, the public imagination is so skewed by biases in the media. I think when you talk about poverty in America these days, most people imagine Black and brown people. If we went back, 75, 80 years ago, most people would imagine white people. Dr. John Powell has pointed out that as that shifted, as images in the media of people in poverty shifted from white to people of color, public support for everything public housing, public medicine, public schools, plummeted. And yet it still remains the case that there's almost twice as many whites in poverty as Blacks. So there's about 8 million and change Blacks in poverty, about 16 million and change whites in poverty. And so you can imagine that data actually has a big impact when you're working with politicians and policymakers whose perspective even of the problem might be warped by inequitable portrayals, if you will, of what the problem is. So could you guys talk for a bit about equity, about what equitable data means to you, and just about how going to the data makes the outcomes better?
Yeah,
I said I could give a couple examples. Many of the projects we do can fall under the label of a needs assessment, let's say, for example, where a community wants to understand, are some populations being underserved relative to their need in a given domain? For example, we were asked to look at the underrepresentation of Latino people in the Philadelphia homeless service system. And there were folks from the Latino community who felt that there wasn't sufficient access, that they weren't able to, help people in their community that needed some of this rental assistance that was being handed out through the homeless programs. And so we undertook a study analyzing what was the likely need in the community based on housing unaffordability and other indicators. We were able to do that across all the different race and ethnic groups and then see what the representation was in the shelter system. And lo and behold, in fact, Latinos were underrepresented, not only in shelter, but also in street outreach contacts, et cetera. And so a whole series of changes were implemented. One was to create a intake center in one community that was more accessible and where there was people who spoke Spanish, because there was no Spanish-speaking people in the homeless shelter intake in Center City, Philadelphia. There, we added a mobile outreach team in the community to help identify people who were living outside and were not getting contacted by the existing outreach system. And then there was special rapid rehousing program dollars that were allocated on behalf of serving that community. So a number of changes resulted, and it wouldn't have happened if we weren't able to put on the table sort of the exact metrics of what that degree of underrepresentation was. And we have many examples like that, but that's the kind of project we might undertake to look at inequitable use of and access to services.
Have a little bit of fun for a second. So, here in Philadelphia, folks are pretty stoked about the Eagles this week. I think the fact the entire country is sort of amazed that they held the Kansas City Chiefs to 0 well into the third quarter of the Super Bowl. If you could wave a wand and shift that conversation, to something that might actually matter more to the outcomes of human beings in this country, data driven, what would you like to see the country talking about right now based on the data that you're seeing? That, you know, if there was greater awareness, greater conversation, we might be moving forward faster as a country addressing poverty and suffering and homelessness, et cetera.
Well, I would say that let's look at young children. I think everyone, you know, we experience raising children and understand, as Della mentioned, all the changes that happen. So many young kids in Philadelphia are not getting basic access to early education, and we get concerned about, you know, what happens to the kids when they're, you know, in high school and the different achievement outcomes and the gaps in achievement. But it really all starts when people arrive in kindergarten, and some kids have had quality childcare pre-K, and other kids haven't had much at all. They haven't had access to good daycare and pre-K education. So when you can show that and you can see how that impacts people, not just at kindergarten, but by third grade and middle school and then on into high school, and then in fact affects their life, you realize that investment in young children is one of the most important things that we can do, and we can do so much more fairly. You know, we did a project, John Fantuzzo and Katie Berghaus at Penn Child did a really cool project. We had the soda tax that was passed, as you may recall, and about half of that money was put into early childhood programs. They created about 2,000 slots initially for kids who were 4 years old for pre-K. And the city was looking to figure out where should we put these, and they were going to put out an RFP asking for proposals on where they should put these programs. And John and Katie were able to use the integrated data system from Philadelphia to identify the neighborhoods where kids had the highest degree of risks in terms of early childhood exposures to homelessness, to limited prenatal care, to having had child welfare involvement, lead poisoning from environmental lead contamination, early experiences of homelessness, etc. So they created a index that each child could be scored upon, and then within that neighborhood you could identify how many kids had 3 or more of these exposures, and then they similarly were able to map out where are the current early childhood quality programs located, and then compare those two. So they found that there were these large areas that were underserved, like, you know, child pre-K deserts, and yet there was the highest need. And that then informed how the city decided to deploy those slots. They put them exactly in the neighborhoods where the kids had the greatest needs and where there were the fewest programs available. So that was a really big win, and the city has continued to use that process. It was a touchdown. So, you know, they're continuing to use that process to spend the early childhood funds here in Philadelphia.
Well, hey, I'm going to throw 2 more questions to you guys. We're down like the final minutes. We're going to speed round here. The first one comes from, and then I'll read the first and the second, and then please, anybody wants to answer, please answer. First comes from Kai Klein. What are some resources, some organizations you'd recommend to help us refresh and update our data analysis skills, especially for qualitative data? And the second comes from Travis Boatwright, who's one of my students, who says, are there any concerns with privacy regarding the over-collection or hyper-collection of data? How might collecting too much data might lead to the misuse of data, especially for vulnerable populations? And any or all of you jump right in, please.
I can jump in for the second question specifically. I think in Baltimore, we are very hyper vigilant around the over collection of information for I guess historically disadvantaged and vulnerable communities. In Baltimore, we have anything that you probably can think about. There is high rates of unemployment, high rates of housing inequity, and especially when we think about our education system. And so one of the things that we always talk about with the development of our integrated data system in Baltimore is that our goal is not to replicate historical harms that have been done in data use for vulnerable populations. And so one of the things that we've done is think about, one, always have a focus on data equity, anonymization of data, thinking about making sure that we recognize that there's humans behind the data. So how are we including their lived stories and experiences as we are facilitating our data projects? As part of our community governance project, we have, as part of our community governance model, we have a group called the Community Research and Action Committee. So that is a committee of 14 individuals that serve as champions and ambassadors, who are just individuals who apply to be part of the process to determine what projects should be facilitated, how are they valuable to the community, and then what is the actual applicable use of those data projects to improve community needs. So whether or not that's going to be policy change or programmatic changes, these groups of individuals work hand in hand with the data stewards, so the people that are analyzing and collecting the data, to ensure that we are not will further marginalize communities that we're working on behalf of and with. And so I think and a part of that is also asking a question, why do we need this data? So from the beginning, what is the minimum amount of data we can use to answer the questions we need to answer? And then how are we ensuring the security and safety of this information as we are facilitating each project?
Happy to jump in on the first question, although I don't think I have a perfect answer. It's not my area of expertise broadly, qualitative analysis, but I do want to shout out, I don't know, Kai, if you are a Penn student, but I imagine some people on this call are, and I just want to shout out a really fabulous opportunity. Our colleague at AISP, Amy Hahn Nelson, who leads our training efforts at AISP. So she goes out and works with sites like Baltimore to support their work building integrated data systems. She is also research faculty at Penn, and she's developed a new certificate program at SP2 called the Certificate in Applied Data Ethics Law and the Social Good. And this program, this certificate, is available to all graduate and professional degree programs at Penn. So you don't have to be at SP2. And it's really about building cross-disciplinary conversations and a pipeline of practitioners who are interested in that kind of mixed methods research using linked data and also qualitative information and stories. And it's helping students who are going to go into these fields in the public sector be prepared to confront these thorny issues around data, over surveillance, kind of building a healthy skepticism about what data actually mean, but also working to improve the quality of the data and the data processes and data governance that we have in the public sector. So just a shout out to Amy for developing that, to SP2 for cultivating that. And if any students are interested, you can always reach out to Dennis or I or Amy to talk more.
Well, and by the way, false alarm, it appears the computer I borrowed to do this is like 18 minutes ahead randomly. So not quite the speed round yet. So let's slow it down a second. But I'll keep you on your toes, yes. Again, let's go back. Dennis's answer was so fabulous to like, what, if you could wave a wand, what would you have people talking about? And Bridget, you kind of live at the corner, of like connection and empathy and just numbers. Like, what do you wish folks were talking about in Baltimore besides the fact that our Ravens, like,
it should have been us.
So what would you like us to be talking about in the city that, actually matters?
I mean, I think that there is conversation currently that's going on about things that are important in Baltimore. I think just broader awareness of the most important issues would be really helpful. When I was listening to the question, I automatically thought about our literacy rate amongst older young people. So we were able to identify that if we don't catch them in their early childhood, that young people in our graduating Baltimore City high schools are severely below grade level when it comes to their literacy rates. So much so that when they are graduating high school and thinking about taking occupational training program tests, they were not actually passing those entrance criteria, which then limited them from going on to higher education if they wanted to, and going into a career sustaining occupation training program. So our literacy rates in Baltimore is definitely something to be thinking about more. And then the access to career sustaining wages and employment. So what is the option for young people as they are graduating from Baltimore City Public Schools? There's this big push to go into their trades, things of that sort, or figure out an occupation in addition to higher education. And so I think access to employment that will lead to family sustaining wages, given our current economic circumstances. I think literacy for older young people, and then our housing crisis as well. Because we know a lot of our young people, 18 to 24, are couch surfing or don't have regular sustaining housing. And that is definitely a barrier that young people that we're engaging with are expressing to us.
What is the data telling you? Again, it's a question of equitable data. And I think, for me, somebody who's been a civil rights leader who started his journey, studying quantitative social research in grad school, the numbers have really transformed my own thinking about what's possible and also what's real. I'm curious for you, if you could, each of you maybe just take a moment to talk about numbers that have surprised you, numbers that when you saw them made you think differently. And again, also, if you could be thinking about for folks who are mid-career, how they can get up to speed and start integrating data more into what they're doing.
Well, I think that seen a lot of shocking statistics, in terms of child welfare involvement is one. A study by one of our colleagues' centers in California, I think, found that about 50% of the families who were Black had some kind of child welfare involvement at some point in their childhood or youth. And just the fact that we have so many systems that seem to be responding only when a problem is really acute. When it has to get your attention. And at that point, it gets very expensive to intervene. It's harder to be effective and intervene. Whereas, all of the prevention programs that we can do, which we can show through these data, are effective. I mean, by the way, that's one of the great values of the linked data, is that you can do a program in one place, like say early childhood and for kids who are in middle school. You can look at an intervention and then you can follow into the future in their data to see what is the impact across a whole bunch of dimensions and how the family has been affected, and not just in terms of bad outcomes and acute problems, but how prevention programs actually lead to enrichment and success. We sometimes lament that a lot of the data we have is gloom and doom, homelessness or incarceration or child welfare involvement. But that's the way our systems are set up. They're set up to respond only when things go wrong. And oftentimes too little, too late, but yet too expensive. So what's great about having education data and workforce data is that they show people achieve, that people in school, they graduate, they increase their performance and testing, etc. They get into jobs, they have families. These are also things that we can follow in the data, and which tell a more positive story. So I think that one of the things that strikes me is that we don't do enough to focus on what I would describe as sort of enrichment opportunities for people, and being able to see and make visible all of those things and how they can reduce the likelihood that people are going to end up having some kind of acute challenge.
If I may build on that, I think a great example of a really preventative kind of approach that's being developed and explored in California right now. So our network partners in California are at the Children's Data Network at USC, and they work in partnership with the Department of Health and Human Services in California, which, as you can imagine, is enormous. And every year there are nearly 500,000 infants born in California. And one thing that CDN is doing with their agency partners right now, they've developed a tool called the California Strong Start Index. Their partners are at First Five and within the government too. And so this Strong Start Index is looking at assets, right? Like looking at the resources, material conditions around each child in California. The index is made up of 12 data points. It includes things like healthy birth weight, family having healthcare coverage, these kind of things that we know are positive and supportive of a family. And it also draws on the birth certificate, which is really important here because what they're working on, they've already been using that data for a while to do what Dennis described in Philadelphia, to place supportive services in the census tracts where they see kids have fewer of these supportive factors. And now what they're doing is really trying to drive targeted prevention and outreach work with that data. So they are exploring the use of social workers in hospitals who can connect with families in the hectic weeks after a new baby is born, which any of us who have had children know that that is a hard time, right? And what they're doing is using that data to prioritize families who the data tell us are starting from a relatively low number of resources or protective factors, and actually asking that family one-on-one, what do you need? What does your baby need? Like, what would be helpful right now? And so that can look like help applying for benefits, help finding childcare in your area when you have to go back to work or school, transportation support to make it to follow-up prenatal visits, maybe a change in your own medication or mental health support in a new phase of life, right? So these are all things that anyone would want and need to have when they're a new parent and they're focusing on this new little baby. And so thinking about the ways that data can actually help us prioritize the people who those supports will be most impactful for and actually reach them at a moment in time where it will have a really big impact.
I mean, it's so true, and there's such outsized impact. There's a group of former community health workers at Johns Hopkins in Baltimore who were so alarmed that about 10% of the people using the ER room were like 50% of the resources. They used to consume 50% of the ER's resources, just 10% of the patients, because they were high need, many addicted, many chronically homeless, et cetera. And yet it was difficult to figure out, even though you knew they needed social supports, where to find all the social supports that were available in the city, and then how to prescribe them in a way that you could track whether they used them or not. So you could have, intervention conversations with them that came back like, I see that, you did go, to the shelter, to sleep indoors, thank you, or you didn't go to the rehab, appointment that we set up for you, et cetera. And they created a company called Healthify that now provides that service to ER rooms and kind of other points of intervention across the country. We got a lot of folks on the call. We've surged at 65, but up to over 100, still about 94, 95 people here, and we're still getting questions about like this one from Ms. Yegros. Any advice for small organizations with limited capacity of data collecting about how to effectively manage program evaluation for adults? And again, the question from Ms. Klein earlier about like where can she go to sharpen her data skills? Any kind of thoughts there? Just you're mid-career, you're running an organization. How do you go about better integrating data into what you do and data collecting, and you're mid-career and you just want to be sharper about all this? Where do you get trained?
Yeah, I can just get started. We work with a lot of smaller nonprofits to support them in building their capacity around data and evaluation. There is a lot of resources out, I guess, on the internet, but I personally also run another organization called the Baltimore Area Evaluators. And so we are a local affiliate of the American Evaluation Association. And most cities, communities have an affiliate there that you can really access their usually they have about either a monthly or quarterly workshop where they're providing support around building exactly data capacity with within nonprofits and research organizations, institutions. And so we do data analytics trainings. A lot of times they are recorded and saved. So I would definitely say like the American Evaluation Association and the and your local affiliate, whether or not it is one in Philly or if you're logging in from a different part of the country, there are some all over that could provide support.
Della?
I don't know that I have a better answer than that. That's a great answer. Thank you, Bridget. I didn't know about that.
All right, Kai Klein is back with another question. In reference to my previous question, yes, I am an SP2 grad from 2016. Thinking of mass demonstrations and protest movements beyond specific policy change, what metrics might you consider when designing an evaluation to determine the benefit of participation to the individual and the community?
That's interesting. So is the question about people who participate in mass demonstrations and protests and what their impact is?
Somebody looking at that and
Yeah.
trying to figure out how do we define the benefit of participation to the individual and the community. You know, I will, just as the former head of the NAACP and the current head of the Sierra Club, I'll dive in on that one while you guys think about it. You know, one thing so I got kicked out of Columbia University in 1994 for leading protest movements. And then I graduated in 97 and went off for the Rhodes Scholarship. And there's a lot of parents who are like, when their kids become protesters, they're like, oh my God, you know, Jill's future is ruined. And the reality is that there's all kinds of social science that shows that what happened to me happens to a lot of young people, which is that it increases your critical thinking skills, it increases your presentation skills, it basically makes you more effective for life. You know, what I would say for communities is what you're really talking about is, you know, what some social scientists have called weapons of the weak in a democracy. You know, talking about people in a vortex that is defined by the fight between those whose power is defined by organized money and those whose power is defined by organized people. And it's mass protest movements, of course, that allow that community whose greatest power is the sheer number of people in that democracy. Well, it helps them flex their power. And it inspires greater courage and solidarity, and it accelerates change. So you know that would be my answer to that. But now that I've given you time to think, anybody else want to dive in?
Well, you know, I was an organizer with the Union of the Homeless some years ago. And one of the things that you observed, to your point, empowerment is not only political and a way to influence social policy and politics, but it's transformational at an individual level. And people, it's actually healing in terms of people's mental health, to have a sense of efficacy, a sense of personal power in your own life, to be able to actually be able to do things, change things, you know, further your own achievement and education and work, and staying involved in community and having a lifelong commitment. So it is a very much a transformational thing. And to getting back to the data, one of the ways you would go about doing that is you would probably have to get a survey of people who participated in protests and then ask for their consent to link it to these things and follow them over time to see what happened. That's one way we would go about doing it, I suppose.
Absolutely. Well, you know, I grew up watching Showtime at the Apollo, and you knew it was the end when Sandman came onto the stage. And here is Dean Sally Bachman, not to compare her to Sandman, but it does signal that we have come to the end. And I do want to thank everybody who participated, all the wonderful folks who were listening intently and sending in great questions. I want to take a minute, Ms. Blount, to say thank you to you, Ms. Jenkins, to you, and Dr. Culhane, to you as well. It's been a wonderful conversation. And with that, I will turn it over to Dean Sally, don't call her Sandman, Bachman.
I don't think I could say it any better than that, Ben. I do want to say thank you to you, Ben, and Bridget for joining us, and of course, Della and Dennis. This was a fantastic discussion and one of our more populated speaker series. This dialogue is absolutely vital to our school's mission, and it reflects our dedication to exploring complex social problems. We remain steadfast in our commitment to social innovation, impact, and justice in everything we do. Thank you to everyone who joined us today. Our next installment of the SP2 Speaker Series is going to be focused on climate, and it's going to be held next month on March 19th. Stay tuned for more information. Thank you all. Take care. And thank you especially to our panelists, to Caitlin and to Kristen. Thank you so much.
Thanks, everyone.
Thanks, everyone. And to those of you who have questions that we didn't answer, I'm sure Caitlin will make sure that we get out responses. Lots of people want to know how they can do more with data. Sign of a good talk.
Really
Thanks.
great. Yeah.
All right. Take care.
Thanks, everyone. Take care.